Well, now to your health. November is Lung Cancer Awareness Month, and during this Thanksgiving week, doctors are urging people to talk about the importance of screenings with their loved ones.
Lung cancer is the nation's leading cancer killer, and a simple checkup could be all you need to increase your chances of survival. And joining us live now to help us raise awareness is Dr. Daniel Boffa with the American College of Surgeons. Good morning.
Good morning, Emily and Travis. How are you guys?
Doing
Doing
well.
well.
Appreciate
Thanks
you
for
taking the
joining
time.
us.
Yeah. Well, let's start with, who is most at risk for developing lung cancer? Where should we start?
So, the majority of lung cancer happens in somebody who smoked. So, 87% of lung cancer happens in somebody who's a former smoker or a current smoker. However, 1 out of 7 lung cancers happens in somebody who's never smoked. And there are some genetic components. So, having a first degree relative who is a smoker. But there are also some environmental exposures. So, classically, we think of radon, things something that can build up in your basement. But cancer can certainly happen in somebody who's never smoked.
Interesting. Yeah, radon is one thing that here in the Northwest, we always have to keep an eye out for that in homes. And those are higher numbers than I would have thought for non-smokers in terms of incident rates. So what should we do when we're talking about screening for lung cancer? What does that look like?
So, lung cancer screening, if you're 50 or older and you're a current or former smoker, you should talk to your primary and see if you're eligible. The screening for lung cancer is a CT scan. It takes a couple minutes to do, and it should be done annually, and it can reduce your chances of dying of lung cancer by 20%. So, lung cancer is a tough cancer, and you really want to find it early when the cure rate is the highest. So, before people have symptoms, that's really the best time. And its screening is covered by the majority of insurance companies, including Medicare and Medicaid. But it really is our most powerful weapon against lung cancer.
I mean, that makes sense. That makes sense. So when you're in these moments and you're maybe wondering if you should go get screened, what are the questions you should be asking? Sometimes you don't. I mean, I think about. I've never been lung cancer screened, but sometimes when you set these appointments, you don't even know what questions you're supposed to be asking in order to get better. What are some of those questions?
Well, the first thing is just, are you eligible? And so if you're 50 or older and have a smoking history, bring up the conversation. But not everybody that meets those are eligible. And so it does depend on how long you were a smoker and how much you smoked. But that's really first and foremost what you want to talk about. And then to talk about, well, what if something's found? What do you do? And lung cancer, it's never been a more exciting time. The treatment, the surgery is safer. It is through smaller incisions. We take less lung, and so people recover faster. They get back to work, to their activity of daily routines. And even if it's not surgery, chemotherapy is also safer and more effective, and we can use the immune system. So you fight your cancer using your own immune system, which again, fewer side effects and works more effectively. We've basically doubled the cure rate for lung cancer just in the past 5 years.
Wow.
Wow.
Well, doctor, real quickly, we're almost out of time, but I can think of relatives. I'm sure everyone can think of someone that they might see around the holidays who, doesn't want to go to the doctor. Ignorance is bliss. They don't need their annual screenings. It's fine. What advice would you give someone who's reluctant to go and talk with their doctor?
So it's to try to understand why people aren't going. Some people think they have to quit smoking. You don't have to. Some people think I don't have symptoms. Well, you want to catch it early before you have symptoms. That's when we cure people. But at the end of the day, people are scared. I'm scared when I go for my colonoscopy. I don't want to become a cancer patient. I don't
Yeah.
want to disrupt my life to be treated. But cancer's common. And so why not find it when it's early, when the treatment is easier and it's more likely to cure you?
Yeah, that makes a lot of sense. Well, that's great information. Dr. Boffa, really appreciate your time this morning. Thanks for joining us here on AM Extra to talk about it.
My pleasure.
All right, take care. And to learn more about the screening process and recommendations from experts, you can go to facs.org/lung cancer screening. Some good information there.